Typhoid fever, also known as enteric fever or simply as typhoid, is a bacterial infection caused by the bacterium Salmonella typhi. It can be life-threatening if a person does not have early treatment. One of the hallmark symptoms of typhoid fever is a sustained high fever, often reaching temperatures of 39 to 40 degrees Celsius. This fever is typically persistent and may last for several days or even weeks. Typhoid fever can cause extreme tiredness and weakness, which can significantly impact daily activities. Patients may feel lethargic and lack energy, even for routine tasks. Abdominal discomfort and tenderness are common symptoms of typhoid fever. The pain is often localized to the umbilical region, but can spread throughout the abdomen. Many individuals with typhoid fever experience persistent headaches, which can range from mild to severe. These headaches may be accompanied by generalized body aches and muscle pain. Typhoid fever often leads to a significant loss of appetite. Patients may have little or no desire to eat, resulting in weight loss and potential malnutrition if the condition persists. Gastrointestinal manifestations of typhoid fever can include diarrhea or constipation. Some patients may experience diarrhea, which can be watery or bloody, while others may have constipation or alternating bowel habits. Nausea and vomiting are common symptoms of typhoid fever, contributing to further dehydration and electrolyte imbalances in affected individuals. A characteristic rash known as rose spots may appear on the abdomen and chest in some cases of typhoid fever. These are small, pink, slightly raised spots that may fade upon pressure and typically last for a few days. Upon physical examination, healthcare providers may detect splenomegaly, or an enlarged spleen, and hepatomegaly, or an enlarged liver in individuals with typhoid fever. These findings are indicative of the systemic involvement of the disease. Additional symptoms of typhoid fever can include a dry cough, confusion or delirium, difficulty breathing, and bradycardia or a slow heart rate. Typhoid spreads mainly through consuming food or water contaminated with fecal matter from an infected person. Inadequate hand washing and handling contaminated items can spread the bacteria. Infected individuals may continue shedding the bacteria even after symptoms disappear. Direct interaction with an infected person, such as sharing utensils or engaging in intimate activities, can transmit the bacteria. Some infected individuals become carriers, unknowingly spreading the bacteria through feces. Detecting and treating carriers is crucial. Travelers to typhoid endemic regions risk exposure through contaminated food or water. Adhering to safe practices and getting vaccinated reduces this risk. Typhoid starts when Salmonella typhi enters the body through contaminated food or water, crossing the barrier in the stomach, then traverse through the M cells in the Peyer's patch of small intestine. Salmonella are phagocytosed by macrophages and multiply within them. They are then spread to reticuloendothelial tissue via lymphatics. Salmonella then drain from thoracic ducts into the bloodstream. Eventually, bacteremia occurs where Salmonella spreads through the bloodstream, targeting organs like the liver, spleen, and bone marrow. Diagnosing typhoid fever can be challenging due to its nonspecific symptoms, which can resemble those of other febrile illnesses. Initial assessment includes medical history and physical exam, focusing on symptoms and recent travel. Blood cultures are the gold standard for diagnosing typhoid fever. During a blood culture, a sample of blood is collected and incubated in a culture medium to detect the presence of Salmonella typhi. A complete blood count can reveal characteristic changes associated with typhoid fever, such as leukopenia and relative lymphocytosis. Serologic tests, such as the Whittle test, detect antibodies produced by the immune system in response to Salmonella typhi infection. However, these tests have limitations, including low specificity and sensitivity, and are not routinely recommended for diagnosing acute typhoid fever. Stool and urine cultures are used to detect Salmonella typhi in feces or urine, particularly in chronic carriers. Imaging studies sometimes are necessary for severe cases or complications like intestinal perforation. PCR tests can quickly detect Salmonella typhi DNA in blood or stool samples. Rapid diagnostic tests provide quick results, but may have lower sensitivity compared to blood cultures. Antibiotics are the cornerstone of treatment for typhoid fever and are essential for eliminating the causative bacterium, Salmonella enterica serotype typhi. Commonly prescribed antibiotics for treating typhoid fever include fluoroquinolones, such as ciprofloxacin and levofloxacin, and third-generation cephalosporins, such as ceftriaxone. These antibiotics are effective against Salmonella typhi and are typically administered orally or intravenously, depending on the severity of the illness and the patient's clinical condition. Treatment duration typically ranges from 7 to 14 days, although longer courses may be necessary in some cases. Antipyretic medications, such as acetaminophen or ibuprofen, may be used to reduce fever and alleviate discomfort. Maintaining adequate hydration is crucial, especially in cases of diarrhea or vomiting, to prevent dehydration and electrolyte imbalances. Oral rehydration solutions or intravenous fluids may be administered as needed. Patients with typhoid fever may experience a loss of appetite and weight loss. Encouraging small, frequent meals and providing nutritional supplementation may help maintain adequate nutrition and energy levels. Adequate rest is important for supporting the body's immune response and facilitating recovery. Patients with typhoid fever should be advised to rest and avoid strenuous activities until their symptoms improve. Close monitoring of the patient's clinical status, including temperature, hydration status, and response to treatment, is essential throughout the course of illness. Follow-up visits with healthcare providers may be necessary to assess progress, monitor for complications, and adjust treatment as needed. Typhoid fever, if left untreated or inadequately managed, can lead to several serious complications that may pose significant risks to the patient's health and well-being. Intestinal perforation is one of the most severe complications of typhoid fever and occurs when the walls of the intestines develop a hole or tear. This can lead to leakage of intestinal contents into the abdominal cavity, causing peritonitis. Intestinal perforation is a life-threatening emergency that requires immediate surgical intervention to repair the perforation and prevent further complications such as sepsis and multi-organ failure. Typhoid fever can cause inflammation and ulceration of the intestinal mucosa, leading to gastrointestinal bleeding. Blood loss from the gastrointestinal tract can result in anemia and, in severe cases, hypovolemic shock. Gastrointestinal bleeding may manifest as melena or black, tarry stools, and hematochezia or fresh blood in stools. Typhoid fever can affect the liver, leading to hepatomegaly, hepatitis, and jaundice. Hepatic complications may result from direct invasion of Salmonella typhi into liver cells or from the inflammatory response triggered by the infection. Severe hepatic involvement can impair liver function and contribute to complications such as coagulopathy and hepatic encephalopathy. In rare cases, typhoid fever can lead to central nervous system complications, including meningitis, encephalitis, and cerebral abscesses. CNS involvement typically occurs as a result of hematogenous spread of the bacteria to the brain and meninges. Patients may present with symptoms such as headache, altered mental status, seizures, and focal neurological deficits. Prompt diagnosis and appropriate antimicrobial therapy are essential for managing CNS complications of typhoid fever. Cardiovascular complications may lead to myocarditis, endocarditis, and require specialized cardiac care. Severe cases can cause acute kidney injury and interstitial nephritis, needing careful management. Other complications include pneumonia, arthritis, osteomyelitis, and disseminated intravascular coagulation. Early recognition and management are crucial. Vaccination is an effective preventive measure against typhoid fever and is recommended for individuals residing in or traveling to regions with high rates of typhoid transmission. Two types of typhoid vaccines are available: the injectable polysaccharide vaccine, and the oral live attenuated TY21A vaccine. Vaccination is particularly important for travelers visiting endemic areas and individuals at increased risk of exposure to typhoid fever, such as healthcare workers, laboratory personnel, and food handlers. Enhance clean water access and proper sewage disposal. Ensure thorough cooking and proper food hygiene. Inform the public about typhoid risks and prevention methods. Implement screening measures to detect and manage cases. Ensure everyone has access to testing, treatment, and vaccines. Involve communities in prevention efforts for collective action. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.